Welcome to the TechLink Health Podcast, an on-demand source for the top trending healthcare topics and insights. Delivered by key opinion and emerging leaders and as featured on the TechLink Health app. The healthcare industry is rapidly evolving, so our goal is to connect listeners to the most relevant insights, ranging from digital health to financial well-being to interesting side gigs. For more details, visit www.techlink.health.
Hey everyone, welcome back to the TechLink Health Podcast. I'm David Sanchez RN, and I'll be co-hosting this episode with Dr. Sarah Saman. Today's episode is a continuation of a series that focuses on innovations happening within the respiratory and immune system health space, with a particular spotlight on solutions that safely and naturally support a balanced immune system around the airway to feed the beneficial oral probiotics that ultimately help calm the immune system and fight allergies. The allergy risk is significant and global in nature. In the US alone, 100 million people suffer from allergies every year, costing $18 billion with a B dollars in annual healthcare expenses. This episode's guest is Dr. Cliff Hahn, a former physician and biologist of 30 years, who's also the inventor of Allerpops. Allerpops corrects the underlying cause of allergies and gives seasonal comfort and lasts through its all-natural prebiotic lollipops. Dr. Hahn is also the author of a recently released book. It's brand new, Nothing to Sneeze At: The Journey from a Small Village in China to Finding a Natural Solution to Allergies. Dr. Hahn was trained as a medical doctor and practiced for many years before getting a PhD from Fudan University, followed by 22 years spent as a biologist at Los Alamos National Laboratory, where he participated in the Human Genome Project and led a team to complete many hundreds of bacterial genomes and author more than 300 research papers. So it goes without saying, Dr. Hahn has a passion for innovation in the respiratory health space, and he's invented a solution that has the ability to help millions of people around the world. So we're looking forward to getting his perspectives on the podcast. So without further delay, we're excited to welcome Dr. Hahn to the podcast. Dr. Hahn, thanks for joining us today.
Happy to be here. Thank you for the opportunity to actually speak with your audience. Thank you very much.
Yeah, we're really looking forward to it. I know Dr. Saman and I were talking before we got on here. We have a bunch of questions for you because this is the situation that affects every family, I think. Really, allergies are so common nowadays. To start and give our listeners some background, can you just take a moment to introduce yourself in a little more detail and just tell us about your personal journey, which ultimately led to your work in the respiratory health space?
Yeah, that's a long journey. But in general, I was led by the nose actually to today to solve the allergy problem. So to start with, I grew up in a small village in China, in Shandong province, China. And in the early 80s, I went to medical school to study medicines, all department, all branch of medicines. But eventually, I was assigned to a mental hospital. So that's where I learned the least. So we had studied psychiatry for one semester and with probably 30, 40 class, something like that. But I was assigned to that mental hospital, worked over there for 4 years. And eventually I found clinical practice was not my passion, or I'm not interested in that. So I went back to school to study genetics. That's actually the attraction to me when I was in the medical school. The first experiment by Mendel, the bee experiment, it was so fascinating. Actually, I was attracted by those kind of studies. So I went back to do the basic research, got my master's degree and also PhD degree in the cytogenetics and the human genetics in those areas. So I got my PhD by studying the Human Genome Project. That was in the early 90s. It's the starting point of the Human Genome Project. Just before I finished my PhD dissertation, a researcher from US, actually Bob Moises, he's actually the director of the Center for Human Genome Study at Los Alamos National Laboratory. We met in Shanghai Fudan University. That's how I actually came here to study the Human Genome Project, participated in the Human Genome Project. Started with mapping the chromosome 16. So I worked on that project for 7-8 years. And then eventually, as you said, we sequenced other projects. many hundreds of different bacterial genome. Those projects trained me the skill to analyze those genome sequences. So that's the personal preparation. But emotionally, I was driven to this area by personal suffering. Early of my life, allergy was quite far from my area of knowledge. Even in the medical school, in the 1980s, allergy was so rare in China. It did not mention much. Most of the disease were still the infectious disease, chronic infection, bronchi, things like that. My mom had. So that was most important at that time. Allergy was not on the radar of the mainstream in China at that time. But gradually, when I came here, that happened in 2006. So my son got allergy. So that's the first things important related to allergy got into my area of interest. So because of that, I thought why he had allergies. My family, we did not have those history and why he had allergies. So that's the question that actually promoted me to study what are other research are studying about allergies. That's where prepared me all the knowledge that. But the last call to action is actually come from my personal suffering. So in 2014 spring, from nowhere, I actually suddenly got an allergy myself. It was really bad. It was so bad I become hopeless. So because of that, I said, if I wait, it'll probably take years. I don't know if there's hope to actually treat my allergy at all. But so many medicines that did not work for me. So that was a big suffering. So I had to say, let me start studying myself. So that's the last call to action. Get me there, study the allergy, what caused that. So
Thank you for sharing your background. It's a fascinating journey. And I can really relate to this feeling of hopelessness that you describe. I live in the Dallas, Texas area, which is one of the highest allergy centers in the country. And so I feel your pain. And I think it's fascinating that you took those personal experiences and made that into a passion project. One of the goals of TechLink Health and of this podcast is to connect consumers with experts, technologies, and solutions that will help them to meet their health and wellness goals. And another is providing the same level of connectivity among practitioners and companies. So let's dig deeper into the topic of allergy relief and tell us more about the problem and the solution that Allerpops helps to address. Walk us through the journeys and the benefits for both consumers that suffer from allergies and healthcare providers that are looking for ways to effectively help their patients.
So let's go through the problem, the sufferings I had actually at that time. So it was started in the evening in one of the meetings. I don't want to go to the detail. It is in the book, Nothing to Sneeze At. If you want to get the detail, you can go through that book. But briefly, it is that my allergy does not like a typical allergy. It started as a year-long allergy. It went through the spring of 2014, the summer and the winter. It did not stop. So that's why I felt hopelessness. My nose was completely congested and could not sleep, and my energy went down because of that. So exhausted all the time. That's the typical problem for at the personal level. In the big society level, I can sense that as well. Just for example, last week we had a meeting about 50 people, and when I asked how many people you have allergies, so I actually could not count. I just say almost everyone actually raised their hand. Then I asked who does not have allergy. Only about 5 or 6 people actually raised their hand. That tell you how common the allergy problem could be. So in the United States, more than 100 million people actually suffer from that. And for me, my personal experience, as you said, actually, many of the symptom treating medicines like antihistamine, it does not work that well. So I had that experience after 2 or 3 years of different tests of different remedies. Only one of them worked for me for the nasal congestion slightly. So that's what happens actually for me. The suffering is big and the treatment is not generally not that efficient. So that's why I started to study my problem, because all the knowledge I accumulated after my son had allergy, and I know the hygiene hypothesis, and based on my personal history as an immigrant, so I formulated the specific oral hygiene hypothesis. So that turned out to be the right direction to go further. So that's why I actually collected my saliva sample, observed my allergy symptom change after 3 years of study. I discovered, some of the bacteria are related to my allergy symptom. If my symptom goes better, those bacteria actually gets more abundant. So that was the observation. And then next hypothesis is, if I raise that bacteria even further, will my allergy actually be gone? And actually it did, because all those bacteria I discovered has been studied by many people for 50, 60 years, and they know what kind of food they need. And I just use those existing knowledge to formulate the prototype of Allapops. And it worked so well for me at that time. That's how we developed Allapops. After further tests and further test of different formulas, we developed the customer-friendly product. So that's the current, we call it Allapops prebiotic. So that it works quite well. So that's the solution. There's some scientific background is that those bacteria, if you want to talk about the detail of the mechanism, those bacteria actually want to make a peace with our immune system. So they want to live in here. This is the best environment for them. That's why they release a group of metabolite, which is called short-chain fatty acid, to tell our immune system, say, we're your friends. Let's make a peace. Don't fight. So when that condition reached our immune system at the peaceful mode, then it will not fight that bacteria that hard, and it will not fight the pollen or dust mite, other allergens neither. So that's how this product relieve allergies, tell your immune system eventually calm down and keep a peaceful relationship with the environment. So the benefit for our customer in that sense is that this is an all natural product. There's no chemicals added. All the ingredients are FDA approved food ingredients. So there's no side effects from that. That's one. And it treats the cause of allergy. That means tell your immune system, calm down peacefully. So that's the natural state it should be. It should be. That will avoid many other problems as well, like autoimmune disease, food allergies, things like that. It will benefit to reduce inflammation in other places. That's why our customer reports say their arthritis, even those things remotely related to allergies, those gets better as well. So customer will use the natural product, remove the cause of allergy, and get long-lasting allergy relief. So that's the benefit for our customers, and especially for kids, they don't want to take medicines, and that's the benefit. For the medical practitioner, allergists, other doctors, I think we are providing them a better tool to treat their patient. So this is a much better tool, and give their patient long-lasting allergy relief. And also, not only this prebiotics product, we identified, as I told you, the group of bacteria up to now added with the current clinical trial study. So we identified at least 5 different groups of bacteria are related to this allergy disease. So those probiotics are going to be the tools for the doctors, allergists, dentists, and general practitioners. It's going to be the tool for them to treat their patient a lot better. So I think the prebiotic lollipops will be the consumer product. I think the probiotics product in the next level are going to be prescribed by doctors to treat the difficult cases. So up to now, we observed most people responded to prebiotic treatment such as allergies quite well. There are a small portion of people, they don't respond to this treatment well. So that's where doctors, allergists, they need to work together. Maybe further study will be needed, and eventually the probiotic or other tools will provide to doctors treat those people a lot better.
Wow. That's pretty amazing. That's incredible. That's very innovative and out of the box thinking, because I've never heard anything about what you're describing as bacteria being linked to the cause of a lot of the allergy symptoms. I've never heard that before. That's really fascinating. And I was looking on your website and it says 94.5% of users feel relief from nasal congestion, 81.3% feel relief from headaches. And just the numbers, 89.5% get relief from nasal discharge or sneezing.
Wow,
That's pretty incredible. That's life
that
changing right
really
there.
is.
Yeah.
It is.
So
That comes
wow.
from our customer satisfaction survey from 2019 to 2020. Yeah,
Okay.
about
How
100
big was
people
that data?
responded to that. About 100 people actually responded to that. But it's not a scientific study, but we send the survey dates request 4 weeks after they purchased Allapops and ask those questions, how their symptom trend changed after the 4 week of using Allapops.
That's really interesting because as someone who suffers from allergies, it's not a subtle thing. When your allergies are flared up, you know it, and when they get better, it's clear. So it's very encouraging to me as an allergy sufferer to
Mhm.
hear those statistics.
Yeah. So along those lines, what advice do you have for other innovators who are tackling problems in global world health? Like you said, this affects 100 million Americans, but what was a thought process that led to this breakthrough for you?
So I told you I was led by nose to this stage of today, and it was that. But to think it back as an entrepreneur or as a scientist to solve a problem, I think the first thing is actually the mental drive, your purpose, why you're doing that, and is that drive enough to actually carry you through the whole process? In the first phase of study of allergy problem, the main drive for me was personal suffering, the hopeless feeling about the current treatment. So I got to study that. I did not know what's the end of the study, but if I don't do it, that's definitely no hopes. I observed all other people suffered for 20, 30 years. One of our customers, for example, 60 years. That was the history. I don't want my life, the rest of my life, suffering like that. So personal suffering can be a significant drive, but there are beyond that, after the study phase, I got my allergy treated, my allergy relief for a long time. And then the entrepreneur path was even harder. Now I know even harder. But at that time, actually, I did not know anything about entrepreneurship at all. And I just say, I have a solution and many people need that. Let's do that. So it was just that simple. So of course, after everything started, so the difficult comes, I went back to think mentally, actually, why I do this, why I do this. So that I list all the things. The main things for me is that as a Christian, I believe this is my training project for this life. I have a lot more things to do to make this world better. So I think this project is a training project for me. During the process, most beneficial person is actually me. I changed myself internally from a scientist to entrepreneur with a mission actually to reduce suffering for millions of people. But even though millions of people, but most benefit I got since up to today is me, because not only my allergy went away, that's minor. It's actually my personal life, my character have been changed significantly. I like this life a lot better than the previous researcher, Cliff Hine. So that's the drive for me to actually go even further beyond this startup stage to make the Allapops a solution for everyone who suffer from allergies. So that's the first thing is the drive. why you do this. So the second is actually know what are other people doing. Like for this project, I could accumulate my knowledge about allergies for about 7 or 8 years since my son got allergy. And I just read all the papers, and that's where I know other people study the hygiene hypothesis. And it is verified by hundreds of, if not thousands of different studies. So that's a solid starting point. We know that is right. And also the next thing is what's your unique proposal? Is your path or solutions different from other proposal other people are studying? So if there's overlap in between, then it's better to check it further and say. So in this case, so I do have the specific oral hygiene hypothesis. With that, so we have the unique path, and I have the unique case for me as an immigrant and all those study, and this is the right path, and it can be verified through my personal case, possibly, because we do say my unique case is I got allergy after 17 years stay in US. Most people actually, they got allergy within the first 3 to 5 years. And because of those changes, my personal oral hygiene change, I thought, my case was caused by oral hygiene, or the bacterial community in my mouth probably changed just before I got allergy. So I have the unique path, solution, proposal, and I have a unique case of myself to go further. So that's why I say, yeah, you if you have all those things, if you have the drive to carry through the whole process, if you know what other people are doing, and you have the unique solution or proposal, go ahead for that. So you'll get there.
So your path and your hypothesis are clearly unique, and that perspective and that drive are clearly, as you're walking us through this process, are what led you to create this product and to research it. So thinking about the theme of best practices, tell us more about that journey to conduct clinical trials and interactions with the FDA. As a scientist, what best practices can you share for those people who might be embarking on a similar journey?
Yeah, as a clinical trial, and both of these front actually, clinical trial and the FDA regulation was not my expertise at all. So even though I have done research almost my whole research career, more than 20 years, but I rarely do the clinical trial research. So I do not have that expertise. Because of that, I actually hired a third party independent clinical trial company. So they have the expertise and the regulation about a clinical trial, all the process, logistic, and including the application to get approval through the government regulation agent. So they helped me to go through all those process, write the application, and prepare all the document and submit it to the regulation agents. That was very important. And if it is me, either I could not do it or make a lot of mistakes, take a much longer time to carry it through. So that's where I say, if I don't have the expertise, find the experts to help me or do that for me. So in the next step, that's the things we are trying to do. We are planning to get FDA permission for some of the claims about allerpops, for example, anti-inflammation. That's probably the first claim we want to have on the box for allerpops prebiotic supplement. So that will anti-inflammation. And then even further about an allergy relief, and those claims probably will take a longer time. I'm not sure currently if they are going to need further study or other people's support from different study and things like that. I'm still not expert in that area. We are planning to hire consulting firm and also work with our attorney, our FDA specialized attorney, work together to get through that process. So it'll take a while. So that's where those regulations are necessary to prevent the public from unnecessary side effects or things like that. I think we, as a company, we need those experts' help to get through those regulation process to comply with those regulations.
Yeah, that's a really important insight for anybody that might be thinking about following a similar path that involving other experts when needed can make that process so much more efficient. But clearly you have the drive and the incentive, and yet that's a big leap. So thinking about how you did your work with the Human Genome Project, how did that influence your discovery? And then what other interesting findings during your research do you think were uncovered that might help to tackle other global health challenges? And then finally, thinking about the future, what's on the forefront in genomics? So, several questions there, and maybe take those one at a time.
Okay, all right. So let's try that first one, the Human Genome Project. How did that prepared the discovery of allopups? It actually in two fronts. It's actually prepared me at the personal level and prepared the possibility of this study at the big scope, at the societal level. So in the personal level, actually, when I involved in the Human Genome Project, I did not have all the knowledge about and the skill to study the human genome at all. As many of the study project is a learning process. During those process, actually, I learned quite skill and prepared me for this microbiome study of my mouth. So, for example, how to write the per script to analyze the DNA sequence data and how actually to do the sequencing. And at the societal level, it's the sequence technology, right? So the sequence technology, the cost, for example, if you compare the cost of DNA sequencing to the late 1990s, so the price actually dropped by 100 orange times. So that's a significant drop. It actually beyond the Moore's law, they predicted the drop, but it's dropped even further with that. So because of the reduction of the cost, that's made it possible to ask the question, what kind of bacteria are there in one community and how abundant they are? So before we have those cheap sequence, it's very hard to get those numbers accurately. So use the culture-based solution. It takes many months, if not years, to get those results. Now we have these cheap tools of DNA sequence. You can just collect the sample and do the DNA sequence, and you get the result. Say, you have 500 different bacteria in these samples and at this different abundant level, things like that. So this is preparing the Human Genome Project actually revolutionized the DNA sequence technology, made it possible to ask different questions at a deeper and detailed level. So study the metagenome, the microbiome, what kind of bacteria are there, and how they are associated with the function of the community. That's a deep level of questions. It made it possible. So that's how Human Genome Project actually prepared me at a personal level and prepared the technology to make it possible to ask these kinds of questions. So that's where the allergy study, could it be used in other area of the disease or health area? It can. So allergy theory, so the allergy theory reviewed by this ALLAPOP study, it reviewed the basic principle, how the bacteria react with our immune system, the relationship between each other, how they react with it. This principle actually is consistent in the gut, in the airway, and on the skin as well. So those interrelationship is crucial for us to have a peaceful life and without all those unnecessary inflammations on the skin, airway, and in the gut, so that it can help you to prevent all those problems. And this is the one side of that relationship, right? So if you have a hypersensitive immune system, you got those unnecessary inflammation make you suffering without cause. On the other side is that the infection. So that relationship can help you actually to fight infectious disease. For example, during the COVID-19, I actually published some of the posts. People actually don't like it. It was censored. with some added notes saying this is not the government instruction or standard knowledge, things like that. But anyway, based on my understanding how the bacteria interact with our immune system, it can give you that conclusion. You should not kill your fever too soon. Before the infection is gone, it's better to have the fever with you so that your immune system will be in the strong fighting mode to kill all those pathogens. So those are the practice actually can help you to fight infectious disease. So that's where this knowledge can help you in other areas. And even further, so autoimmune disease is the same things, almost the same thing in the allergic area. When you react to the external allergens, we call it allergies. If your immune system reacts to the internal antigens, then we call it autoimmune disease. So this knowledge, this allopops theory can help you fight autoimmune disease as well. So those are the things we can expand beyond seasonal or year-long allergies. So that's why actually our customer report their arthritis got better. At least some close to half of them actually their inflammation in those areas gets better.
Yeah, that's incredible. That's incredible. So I did have a question related to that. When I worked on the clinical side in acute care hospitals, I worked with a lot of patients that had transplants that had to take anti-rejection medications. Do you think this could be something that would affect that in the future, maybe, possibly?
Yeah, I think that's in general, it will help in that direction. So reduce your immunity, unnecessary immune reactions internally or externally. So I don't know in that specific area how much it will help. It definitely, if you have allergy, that's definitely on the other side, you got to reduce that. And when you have a normal immunity, will that help you for your transplant organ? So I do not have that study. So probably further study need to be done in those areas and how much help allopups can help in that direction.
Okay. So thinking about the future, if you think about the next 10 years, how do you see allerpops continuing to evolve as far as innovation, respiratory health, especially new technologies, and the ability to share data, which can improve outcomes for digital health scenarios and like remote patient monitoring?
So I want to focus in the allopops area. All other health area, I'm not expert to say about AI or even respiratory health, other area, I'm not expert in those areas as well. As for allopops, the involvement in the future, within the next 5 to 10 years, we are actually trying to satisfy our customer with new products. Even in the immediate area of allopops, people like to have new flavors. Instead of allopops, some people don't like the steak, so we can have a lozenge. That's the immediate improvement of our product. And we just released the toothpaste. So Allopop's prebiotic toothpaste can help our customer more efficiently than Allopops alone, because the regular toothpaste always have those chemicals to kill the bacteria. No matter they are good or bad, their purpose is to remove as much bacteria as possible when you brush your teeth. Unfortunately, for the people who suffer from allergy, we do want some of bacteria, the group's probiotics, to be more abundant. You cannot kill all of them. So that's why we have this prebiotic supplement in the toothpaste. So the toothpaste is made with traditional cleaning agent that is gentle to those beneficial bacteria and can help them to recover fast with those added prebiotics. So when you use these two together, you get relief in a much shorter time. And also the toothpaste, if you use it after you got relief, and it helps you to maintain those allergy relief for years to come. So that's where this toothpaste will help you. And also some people like to use their mouthwash. So they have alcohol or other antibacterial chemicals in it. It's very strong sterilized agent and try to remove all bacteria on the teeth, on the gum, and in the mouth. That is too much. That is too much for the people who suffer from allergies. So that's why we developed those prebiotic supplement, prebiotic mouthwash. We call it Ella Fresh. So that will help those people if they need to fresh their smell, clean it briefly for an hour or two, things like that. They can use Ella Fresh, which is mouthwash tablet for their needs. And because we understand how the bacteria interact with our immune system, now we actually try to expand beyond the respiratory use of this knowledge, like solve the skin problem, eczema or joint pain, things like that. We can design some prebiotic supplement for the skin microbiome to reduce the inflammation on the skin and in the joint. So to reduce inflammation, reduce the joint pain, things like that. So that's where we are going in with Alapos within the next 5 to 10 years.
That's really interesting. And I love the idea of the toothpaste. That's something that you can just integrate into your daily routine and not really have to think twice about it. So just a fascinating direction. I'd like to take a moment to step back and just circle around to your experiences as an international medical graduate with the idea and the understanding that you are a physician, although you transitioned to being a medical scientist before coming to the United States. We know that about 25% currently of licensed US doctors are international medical graduates. So tell us a bit about your experience and what advice you might have for other international medical graduates as they seek opportunities in the US and perhaps in other countries.
Yeah, so the medical background, the medical education for me actually is my background knowledge for me to study the allergies. I have not think about practice medicine at all in the United States, so I don't have difficulty in that direction. But I know some of my friends they studied medicines in China and come here became doctors, or they have gone through those process. At least a test, medical license test, things like that. It takes years to get it through. There are some other people redo their medical education or select a small branch of that to study further, things like that. Those are a possibility as well. But I think there are many different ways, different channels to get your career path in this United States. So I think as long as you have the knowledge and skill, you will be able to use that, no matter it is in a physical study or clinical practice. It just take effort. So if you have the drive to do that, you'll get there.
Fantastic. And I also understand that you're currently running a We Funder campaign. Can you tell us a little bit more about that?
Yeah, we found a campaign. This is the second time. We did once actually in 2021. We reached about 300K in combination of on and off the platform. So we're going to close that by end of July. So that's our plan. So this platform is different. If you know the traditional crowdfunding, it was a donation or a pre-order of the product like Indiegogo or Kickstarter. This is different. This is actually investment, a serious investment. That means you buy the stock of the company. This really early stage startup company. So this is a game of high risk, really high risk, and really high reward as well. So if you have a taste in those kind of games, go jump into and do a diligent study on each of the different companies, their technology, their team, and things like that. You may get a serious reward from that. We believe we have the potential, so come to examine that, and we'll hope to not only benefit many people, but profit many people as well.
Oh, that's excellent. So I did want to talk about your book because we haven't really discussed that much, but Nothing to Sneeze At. I love that title. That's really good. So tell us, what's the premise of the book and what is it really all about?
So the book was actually designed to tell my story, how I get to the solution of allergy relief. So it started with my early age, grew up in a rural area in China, because all those background knowledge actually helped to tell you some of the story, one of the story actually why this early environment actually helped. Because think about it, in the 1960s and 70s in the rural area in China, there's no running water. And we actually, 20 people live in a courtyard. The very small room. With total together, it's about less than 1,000 square feet rooms. So it's very crowded, and plus with all those farm animals all together. And so that's the environment we live. That's the hygiene conditions we live in there. By comparing those environment with the environment we have here in the United States or Europe, that's other people did the scientific study. But my personal journey actually verify those difference, and I can identify those things. Even oral hygiene, no people brush their teeth at that time. So the brush handed to me only when I was in the middle school. So that's how those conditions actually made me focus on where my oral hygiene was and how big a change after I came to the United States, and what's the process to change that. And all those conditions actually gave me the hint and see where to focus. Those are the stories in the book. And of course, during the process of the research and the entrepreneurship, there's up and downs, and most of them are downs. There are a few times of ups, but anyway, so those are recorded in the books. I try to share with fellow entrepreneurs and say, this is my journey. If you want to be jumped into this world of entrepreneur, prepared, lots of downs, and prepared to actually get through that. But it was a challenging journey. I cannot say enjoy that, but it's definitely my preferred journey. So that's the things I want to say in the book. And also in the process, many people helped me in the process as entrepreneur during the study. I want to give them my acknowledgement as well.
Oh, that's great. That's very good. So related to that, you said about 100 million people in the US suffer from allergies. How does that compare to the rest of the world? And then why is that?
Yeah, the 100 million in the United States, that's about 20 to 30%. We're actually in the middle. We're not in the top. So the ratio of the population have allergies is from 5% to 50%. So like in Japan and UK, Korea, they have a higher percentage of population have allergies. In China, it's in the single digits, probably between 5 to 10% currently. When I was there in my early life, it was below 1%. So they have increased as well. And the Western developed country increased the most from less than 2% up to 50%. So that's really a significant jump. That's another side evidence to tell you actually there's something quickly changed during those short time. It's definitely not genetics. It's not some other health problem or things like that. So something quickly changed. That's what I identified as actually oral hygiene correlated to that quite well. That I published a book article about oral hygiene hypothesis. The number of dental hygienists is correlated with the number of allergy sufferers in the population quite well. Of course, there's correlation. It cannot confirm that with that data sets alone. Fortunately, the first study with my oral microbiome confirmed actually they are related. So that's where US is in the middle, but it's quite a number. 100 million is a lot of people. Around the world, it's about close to 1 billion people probably suffer from allergies. In this short 50 years, this allergies become so dominant, become almost number one chronic disease in the population. So that's really something we need to address and increase the quality of life. So as I told you, allergy does not kill you, but the quality of life become hopeless for me. That was not good. That was not good. So you don't want to have a regular recurring suffering waiting ahead every year. That thinking is actually quite bad. So that's the things I think right now we solved that problem. It's just how we can actually tell the world this is the solution and you don't have to suffer anymore. So the 100 million people, I think we can tell them through the message like this. I thank you for having me give this platform to tell other people.
Yeah, absolutely. Just have a couple other questions before we wrap it up here. So I have lots of children, young children. I have 6 kids. Most of them under the age of 12. Is there anything that I can do as far as oral hygiene to help prevent allergies with them?
Yeah, we do have ways to prevent allergies. Think about back about, let's say, 18 years ago, my son, okay, my son had ear infection. He had it twice. Ear infection. Every episode of ear infection, he will take 2 weeks of antibiotics. So that antibiotic totally destroyed, as now I think right now, destroyed the oral microbiome. Okay, that's how he got his allergy when he was 1 or 2 years old. To prevent that from happening, what we can do is after, for example, my son recovered from those infections, let's see, give another 2 weeks, all right, make sure that infection really gone. And then we can use Allapop's product. Or if you don't want to use Allapop's, you can just use the toothpaste. Brush the toothpaste, get those good bacteria recover to the good level. And that will prevent many people from have allergy at all. So that's the way to prevent. So the other way, of course, the oral hygiene is related. But before I go too deep about that, I want to tell the world exactly this. We do need oral hygiene and not tell world say you don't have to brush it. We do. We do need to brush our teeth regularly, once or twice a day. That's probably should be enough. But beyond that, beyond keep our teeth and gum health, you don't have to kill all the bacteria in the mouth. So the chemicals we put in, especially the mouthwash, or some people use oil pulling and other tea oil, things like that drop onto their teeth, things like that. It's not necessary. It's not necessary to remove all bacteria in the mouth. So we need to come back from that extreme, and we can have the dentist or research community to do more or high number of participants study to actually get a new standard. What's the best oral hygiene practice? So is that brush once or twice? Or is that going to be different from person to person, right? So you probably need to brush twice and he probably need to brush only once. So those standards, how deep is the depth of the pocket is healthy? Is that 1 millimeter or is that 3 or 4 can be accepted as well? And those are the standards we need to re-examine so that we have a standard to keep our teeth health until we leave the world and also prevent us from having allergies. At least not this many people having allergies. So I think we can reach those goals to redefine the best oral hygiene practice. By doing that, promote the good bacteria after antibiotics and have a good or better oral hygiene practice. So that's going to be prevent your kids from having allergies.
Thank you. Dr. Saman, did you have any other comments or questions?
Yeah, just one comment. This idea of living with a healthy bacteria population, it's something that we're discovering throughout the body and affecting probably all the organ systems. As a cardiologist, we're beginning to understand how the GI tract and the bacteria in our gut can influence our cardiac health. So it's just a fascinating time in our understanding of the way that the body works and the way that our human body has to coexist with our bacterial colonizers. And I think that this is just another example of how we have misunderstood for so long the importance of allowing this natural balance to coexist.
That's right. This balance is important as long as we want to live in this earth. But if you have possibility, move to Mars, okay, and have a sterilized condition, you don't have to bring any bacteria with you. So human actually can survive in the sterilized condition relatively healthy. But the thing that is not possible for everyone on Earth to stay or live in those sterilized conditions. That's probably the worst life you want to stay because you have to live in a bubble and without any interaction with other people, other bacteria, or other environment. That's not enjoyable at all. But if you want to move a colony of human being into a new planet, you can do that. You can do that, only move the human without any other life. So it can actually survive with that because actually people studied with those germless mice, right? So they actually can survive in those environments quite healthy, actually slightly longer than controls. So that's how you do it. But as long as we want and we have to live in this world, and we got to make peace with visible environments and invisible microbes. So we got to keep peace with them and live peace with them, and don't try to kill everything besides us. So that's not a healthy condition for sure.
Thank you. So closing here, any final advice for consumers or patients that are interested in respiratory wellness or practitioners who want to stay connected to new innovations in this space?
Yeah. So for the potential consumer, for our potential customers, if you have allergies, I advise you come to allerpops.com, ALERPOPS.com, to study our solution. So our prebiotic solutions, and say if this is a good solution for you, can you try that? And could it help you to reduce your allergies? And ask hard questions, and say why you think works, things like that. And make sure all those ingredients will help you. That's the things you can do. And if you're not convinced, just leave your email, and we will update you about our progress and other areas as well. For the practitioners, I advise you do the same. I think we are the leader in this direction. We're the first mover in using prebiotics to promote the good bacteria in the mouth to treat allergy and related issues. That's why we tell you not only allergy will benefit, autoimmune disease probably will benefit, and you can use that theory to help your patient treat the infectious disease as well. Go through the study. We have the white paper. If you are a doctor, biologist, and you can examine our study, our white paper, and we'll have the clinical trial published as well. At least we will have a preprint will be available within the next several weeks. Go into our website and follow us on our social media account. So we'll update you about our progress and see how those newfound knowledge can help you to serve and help your patients. Yeah, come follow us. Thank you.
Great.
Thank you so much. This was just a fascinating conversation.
Thank you, Sarah. Thank you, David. I'm really glad to be here to talk with you. And thank you for the opportunity to reach out to your audience as well.
Thanks for listening to this episode. TechLink Health is a healthcare advisory platform for consumers and organizations to stay informed with the latest insights while connecting with healthcare experts for telehealth, e-consults, and consulting services. For more details, visit www.techlink.health.